Mr. Smith. I was in earlier and we discussed that there's a medical order for you to have suction done today. And we talked about the fact that you could have pain medication before we started this procedure, and that it could be done 30 minutes ahead, which you opted to do, and so now it's 30 minutes later. Also at that time when I came in, we talked about if anytime during this suctioning, which will just remove some of the secretions from your lungs, that if anytime during that time you are having a problem or can't breathe well, that you will raise your hand so that I will know to stop, and I will stop, okay? I need to identify you, and I see on your name badge that your name is Mr. Smith and that your birthday is July 1st in 1950, is that correct? Okay, very good, and I'm going to just verify that with the computer, and that is right. Okay, let's see, I'm going to listen to your lungs, and I'm going to watch for rate and effort, and I'm also going to check your O2 here. Okay, and I feel like that suctioning would be a good thing for you. So we'll go ahead and get ready to do that. Is that okay? All right. I am going to turn my suction on to between 80 and 100 millimeters of mercury, and I'm going to put mine on 80. I am going to cover you, Mr. Smith, with a covering here, and I'll get a few supplies ready and then we'll begin. Okay. This way. I'm going to put on my sterile gloves, and we'll get a little box with some saline set up here, and if I can get my fingers in. And then we'll begin. And just remember, if any time during the process you are in distress, that just to raise your hand and I will stop the section. Our section going. I am going to connect these two, and then I am going to make sure that we have suction here, and we do. Okay, and before we begin, I am going to give you 3 to 6 breaths to hyperventilate here. If you were wearing 1, 3. A mask, we'd remove it before we did this, but you have the nasal cannula. Okay, I am going to start the suctioning here. So we'll do this, we'll begin, take it down to where the predetermined length that the doctor has provided, and we'll suction for 10 to 15 seconds. Remove our suctioning and hyperventilate for 3 to 6 times. And we will clean out our section. We would do this 2 more times if he needed it, and then after the last time we'll go ahead and suction out his mouth. Make sure we get all the secretions out of there. And then I will remove my equipment here, turn off the suction, and then I am going to put on, for hand hygiene, put on my gloves, and we'll provide some oral care. Okay, there you go. Clean everything out. Are you feeling better, Mr. Smith? I am going to go ahead and listen to your lung sounds again, and listen for effort, rate, and check your O2. Sounding much better. Are you feeling better, Mr. Smith? Okay, next we're going to go on and we're going to provide some just tracheostomy care. We're going to replace your inner cannula and your dressing. Is that okay? All right, I am going to open the inner cannula, sterile inner cannula package, and I'm going to open my tracheostomy package, and I can't put my sterile fluid in there because the gloves are covering, so we'll do that in a minute. I am going to just quickly remove this inner cannula here and your dressing, and I'm going to assess the cannula for type of drainage, the amount, the color, and odor, and then I will dispose of this in my glove. And before I do the next part, I am going to put down the side rail, and I would have done this at the beginning. I would have done this in the beginning. Okay, the next thing we're going to do is I'm going to quickly put on my sterile gloves, and oh shoot, I did that wrong. I should have touched here. I'm going to quickly put on my sterile gloves. And insert the new cannula. Okay, and then I am going to pour my saline solution in here. Oops, touch the top with that. I think I'm going to have to redo this from here because I didn't touch the, can we edit that?